My name is Chelsea, and on behalf of the Academy of Medical Surgical Nurses, welcome to this special episode of Med-Surg Moments, the AMSN podcast. This podcast is an engaging look at the lives of and surrounding medical surgical nurses. In June 2020, AMSN and MSNCB pledged to actively do their part to end racism. That pledge has led to a comprehensive project to address diversity, equity, and inclusion more broadly. AMSN believes that we, as nurses, start from a position of caring and compassion, that every nurse wants the best possible outcome for their patient and for their teammates to be respected and supported as an integral part of the team. AMSN has developed an educational program that will focus on all aspects of DEI and Med-Surg nursing care. And here with us today to talk about this new program is the AMSN CEO, Terri Hinkley. Hello, Terri.
Hey, Chelsea. How are you?
I'm awesome. How are you?
I'm great. It's so exciting to be here with you this morning. I did a podcast recently with Carolyn and Evie, and I just love getting to come and hang out with you guys.
We love having you. I really enjoyed. I can't believe the last time I saw you in person was in Chicago in 2019. It feels just yesterday, and I can't believe it'll be almost 2 years here soon.
I feel very much the same. I feel like it was yesterday, but then I feel like it was 5 years ago because it's just been such a strange year and a half, and everybody's really excited for trying to get back to some semblance of normal, but I don't think we're out of the woods yet. So keep your fingers crossed. And we're certainly doing our best to make sure that all of our members have what they need from us as they continue to navigate this very interesting time.
And you guys are doing an awesome job. I can personally say that I have felt very supported by AMSN and MSNCB as well.
Oh, Chelsea, that's great. I'm so glad to hear that.
We're talking about DEI today. That's diversity, equity, and inclusion in nursing care. First, I've never actually heard of DEI before I was presented with this topic. I think DEI is a great component that we can add to nursing care and also nursing education. I'm a huge advocate for education beyond the classroom. I'm interested to hear what you have to say. Let's start with the backstory behind this new program and what prompted these efforts. And most importantly, why now?
It really started last June with George Floyd's murder, and I really struggled. I think a lot of people really struggled, but personally, I found it so difficult to watch. And actually, I avoided watching the footage for quite a while because I didn't feel emotionally prepared to do so. And all I kept thinking was, when is this going to stop? How do we get this to stop? And what can we do differently and better? What could I do differently and better? And I really had a moment where I spent a lot of time reflecting on whether or not I had been the ally that I would like to be. I have a Black cousin by marriage, and my daughter is in a long-term committed relationship with a person of color. And I really struggled with that whole thing. So I actually wrote for one of my CEO blogs that I do every month. I called it My Reckoning, and I committed to AMSN and MSNCB that I would be better and I would do better. And in conversations with the presidents of both AMS and MSNCB, they felt equally as strongly about it. So they wrote personal commitments, and it turned into organizational commitments from all of the leadership, including both boards, that enough was enough. And we felt that there was something that we needed to actually do to be able to address this topic. And over the course of a couple of months, that's where it started. And it just snowballed and gained momentum from there. And we did an open pledge that was open to any members that wanted to make their own commitment to end racism. And then we realized racism was just one piece of the problem and one piece of what we were all grappling with as a nation and a world, quite honestly. So we expanded sort of our efforts, and we started looking at DEI more broadly and realized that there was probably a lot we could do in terms of advocacy, education, information, community for all Med-Surg nurses related to DEI, and started to talk about the fact that this isn't necessarily anything that's taught. We pride ourselves on being lifelong learners, but we didn't necessarily have access to feel safe sometimes, even to admit that we were ignorant on some of these topics, and really wanted to try and help people navigate what some of the challenges are and how to overcome them. So I loved in your opening that you said that we started with the premise that nurses are caring, nurses are concerned about individual health and well-being. And we decided to start and recognize that we believe everyone is well-intentioned, and we believe that it's just an issue of building competence, quite honestly. So we're focusing on an educational program. We formed a task force and a steering committee to help us in a couple of different areas, actually be able to speak with the members and the certificants and drive conversations, even if those might be sometimes uncomfortable, and really try and help our members, certificants, and frankly, all of us navigate what really is such a critical topic. It's easy to be upset and it's easy perhaps to be outraged, but we wanted to actually spur some momentum towards action with all of those things.
I think it's interesting that you mentioned one of the buzzwords surrounding a lot of this, allyship, and what it means to be a good ally, and what it means to not only be a good ally, but then to make other people good allies too. So I think that's a really important information about that. Let's talk about the importance of DEI in patient care. I can off the bat think of reports about Black women dying during childbirth at rates that are not acceptable in somewhere like the United States. You hear about Black people not being treated for pain correctly because there's this misconception that A, we don't feel pain, or that our pain isn't valid. We see how differently sickle cell patients are treated. As a nurse, I'm seeing this and also experiencing this as a Black person.
Yeah, Chelsea, we've definitely encountered or heard very similar stories. And I think that's exactly what we're trying to amplify in terms of the work that we're doing. And it aligns so well with the Future of Nursing report that's just come out from the Institute of Medicine, the Future of Nursing 2020-2030, which really does have a very significant focus on the social determinants of health and health equity. And the statistics are just overwhelmingly clear in that our healthcare system is based upon a structure of implicit and explicit, quite frankly, bias. And we don't see the equity in access to health. We don't see the equity in access to healthcare. We certainly don't see it in terms of patient outcomes. Chelsea, you gave some great examples. Even thinking beyond race, there's cultural challenges that we face in trying to understand different cultures and what's important to them in their care. In some cultures, there's religious aspects to the care that can be provided or received. You know, it might sound odd, but I was caring for a Sikh gentleman when I was nursing in Toronto, and I was trying to put him on the cardiac monitor, and he had a very hairy chest, and I couldn't get the leads to stick. And I said to him, "Sir, do you mind if I shave your chest so that I can try and get these cardiac leads to stick?" And he was very distressed. And I thought I just couldn't understand what that distress was stemming from. And then he told me that religiously, they are not allowed to cut any of their hair. Like it was a very distressing event for him that I might have to shave his chest to be able to provide the medical care that he needed when it was at odds with his religious beliefs. And until that minute, when he explained that to me, I had no idea. I think it just shows us the very many areas where we're perhaps ill-prepared or just uninformed in providing competent care to a variety of individuals. We also have, in terms of LGBTQ plus rights or patients, we do a poor job with them and with their outcomes. And our system by design doesn't really handle anything that isn't a very binary male, female, for example, with pregnancy testing on trans men, for instance, when they present to the emergency department. And unless we can make it a really comfortable an open place for patients to share information with us, I fear that we potentially miss things in our care as well, because we're not able to consider the whole person in the care that we're providing.
Thank you for that, Terri. I really appreciate how you made the direct connection between DEI and patient outcomes, because I think that's what the missing link is for a lot of nurses. We think of those concepts separately, especially in the field of medicine when we're thinking of like a medical diagnosis. I think a lot of us aren't connecting those dots. And I really like how you gave some solid examples about how to connect DEI to patient outcomes.
Chelsea, when we consider building competence, we allow people to build competence in every area of their lives, and we never expect them to be experts in anything without significant time, attention, individual learning and development. And it just struck me that this isn't really taught well, if at all, in nursing school. We don't expect nurses to be able to be, air quote, be nurses without a significant amount of education. And I just don't understand why we expect people to be competent in topics related to DEI without the same focus on education, which is really what we're trying to do, and hopefully show some different perspectives and broaden people's understanding of the topic. AMSN's approach to this DEI topic is to really look at three different areas, and the patient and patient care is a significant piece of that. But we also are talking about DEI in terms of healthy workplace and what support we're providing our peers, our healthcare interprofessional team members, and recognizing that there's a lot of discrimination, unfortunately, in healthcare work environments as well. So we're trying to amplify that topic in this whole initiative. And we hope that by having a task force and a steering committee working with us to start conversations, to acknowledge some of the challenges, but look for solutions, that we can actually make a difference, not only in terms of patient outcomes, but also in terms of the workplace for nurses and team members. We're hoping that we can make a safe and equitable workplace for individuals on the healthcare team, nurses, and our colleagues that might have previously experienced a lot of discrimination, and really work to change the work environment and the biases that are embedded in the healthcare work system as well.
I think it's great that we're applying DEI to the workplace and creating a framework for nurses to get educated on that. As someone that has experienced microaggressions in the workplace for several reasons, I can definitely appreciate that. So I talked about how DEI is not only important in patient care, but also throughout the healthcare workplace. As an organization, how is AMSN embracing diversity, equity, and inclusion?
Chelsea, that's a great question. And that's the sort of third prong of our DEI initiative, is we've committed to actually have a deep look and an honest look at ourselves as an organization. Are we exclusionary? Are there individuals that we could invite to participate more actively than we have? What is our process for volunteer selection, for example? What do our policies say? Are we unnecessarily exclusionary in our call for volunteers or any of the things that we happen to do internally? We can't do the work in the first two areas if we don't also do the work in the third, meaning DEI crosses over every part of our lives. And we recognize that with our blinders on and with our unconscious bias, we've probably built policies that exclude individuals or groups of people from being able to participate with us completely unintentionally, but that's the outcome regardless. And we're committed to doing what we can to make sure that everyone feels like they have a community and a home with AMSN.
You brought up a great point surrounding a lot of activism right now. It's kind of like the huge concept of tackling the institution and making those fundamental changes, one, that will make a difference, and two, that will last long and change the culture of a lot of nursing institutions.
Absolutely. I couldn't agree more. And I think there's so many examples of people struggling to try and figure all of this out. That's the $64,000 question, isn't it? Or probably $64 million question. And I think that we want folks to know that we don't necessarily have all of the answers too, but this is a journey that we're willing to take with people and really explore and be open to acknowledging our biases, our own failures, committing to overcome and correct them, and try and focus on helping people become more comfortable talking about these topics. Another example, the first time I heard the word cisgender, I had no idea what that meant. And I had to look it up. And then I realized that cisgender means that someone identifies with the biological sex that they were born with. And I realized that just how ignorant I was in terms of appropriate LGBTQ plus language and how I could actually educate myself and commit to educate myself so that I wasn't relying on that community to do the education of me or for me, and that I could actively participate in using the right language. I have another story that I tell often in trying to show what we're trying to help individuals address or how we're trying to build competence. I had someone relatively close to us come out as non-binary, and I have been practicing pronouns for months now, where I very intentionally, if I don't know if someone identifies as male or female, I try and use they pronouns, because it sets me up to recognize that it might not be binary, he or she. And part of the reason for that was when our friend came out as non-binary, I had another friend that was so distressed at the thought that they might misgender them based on their past relationship and our friend's past identity. And it was really difficult for our shared friend to feel they were unable or ill-prepared to be that welcoming, supportive friend. So we had a long conversation and discussed using they, them pronouns and how it causes sometimes a lot of cognitive dissonance because we're so used to he, she pronouns. And they, them is traditionally referring to a group of individuals. So it's really hard to get used to saying they, them for an individual. And I just explained to my shared friend that our non-binary friend would not be offended if they made an honest mistake. But if they were trying to support and use the right pronouns and be inclusive, that they would forgive the odd slip, perhaps, with using a he or she pronoun. And then I encourage them to practice. One of the things that I've been doing over the last 4 or 5 months is referring to individuals if I don't know them personally and know their gender identity. I try and refer to them as they, them instead of he, she, so that I continuously remember to use inclusive pronouns.
That's a great practice to have, Terri. Will there be specialized nursing practice education on the horizon, taking into consideration DEI and culturally sensitive nursing practices? And then I also want to know, how did you navigate around the patient with the hairy chest?
Those are both great questions. And I'll start the first one with the education. So AMSN is actually investing in a DEI program. It's actually going to be 6 modules long. And we are tackling, first of all, what DEI is and why it's important. And we're starting with some just basic terminology. We're defining populations. We're defining microaggressions, for example. Chelsea, you used that earlier to talk about yourself, but we really just want to set the stage and we want to demonstrate why this topic is relevant for all of us. And then we're breaking into other modules that are specifically addressing certain communities that have traditionally been discriminated against. So we'll have a module on race. We'll have a module on culture and religion. We'll have a module on sexual orientation and gender identity. We're looking to develop a module on people with disabilities and ageism. We feel that there's additional learning that we can do in individual modules specific to certain populations that can be helpful and help individuals understand some of the specific challenges for any one of those groups, as well as opportunities for learning and for being a better ally, a better care provider. The first module is almost done. And that first module, the AMSN board feels really so strongly about this topic. That first module of the program, they're actually going to offer free for all members. There won't be any charge to be able to access that. We feel that's our commitment to education, most certainly on this topic. And then we're continuing to work on the other modules. We anticipate the full program probably will be done early 2022 But individual modules, I think we've got 2 other modules in development right now. So we're really excited about that program. And then in terms of your question about what I did with my patient, I actually encouraged him to reach out to his religious leader and ask if it would be okay for me to be able to shave his chest and to explain why, because I felt that his distress, which really was quite significant, required me to support him in making sure that whatever actions needed to be taken were actions that he was able to be comfortable with his faith. So he reached out, or had his wife reach out to their religious leader and explain that he needed to shave his chest for care reasons. And then we were able to do that.
Awesome. And what a great way to advocate for your patient by helping them, suggesting that they reach out to their religious leader to help them feel a little bit better about making a decision. So thank you, Terri, so much. As always, it's great to have you as an honorary co-host of Med-Surg Moments. Thanks for joining us today to discuss these important efforts.
Oh, Chelsea, it's always a pleasure. I always love coming and talking with all of you, and then the membership indirectly. So it's always a pleasure to be here with you. Thank you for speaking with me this morning.
We look forward to connecting with you on the next episode of Med-Surg Moments, the AMSN podcast. In the meantime, we want to hear from you. Send us your questions, topic ideas, and feedback via our official Med-Surg Moments email address, amsnpod@amsn.org. That's amsnpod@amsn.org. We'd also like to remind you to become a member of AMSN or renew your membership at www.amsn.org. You receive lots of cool benefits and perks such as discounted pricing on the annual convention and continuing education. We encourage you to help us spread the word and subscribe to the Med-Surg Moments podcast via your smartphone podcast app to receive notifications of future episodes. Please be sure to leave us a review and recommend Med-Surg Moments wherever you get your podcast to help us reach even more listeners. We invite you to join the conversation by sharing your ideas and questions on AMSN's Facebook, Instagram, LinkedIn, or Twitter pages, and don't forget to add the hashtag Med-Surg Moments to your post. Simply enter AMSN in the search field on any of these social media platforms to connect with us. The content within the Med-Surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses. Until next time, I'm Chelsea, and always remember, Med-Surg Moments is a moment in our lives, a moment in our Med-Surg careers that makes a huge difference.